Hello, I'm Dr. Helene Fronick, and I'm here with my friend and colleague, Diana Newhart. Diana, you are one of the most extraordinary ultrasound technologists who I've met.
Well, thank you.
Yeah, you're welcome. You're welcome. And you know, to me, ultrasound is the single thing that has changed the field of vein treatment more than anything else in its entire history.
Well, I agree, and I can say that because I'm the master of that technology. It's a technology that has evolved, and not only in phlebology, but other segments of medicine. As the technology has improved and the digital sophistication and all the things that have made it better, we've actually been able to bring treatment options to patients. And that's all because of engineering. So the engineers who started making the device, they said, how could we make it better? And as sonographers and sonologists, we said, hey, you know, if we could see closer, if we could do this, then we could offer this for a patient or make a better diagnosis.
You know, if I could get a hold of some of those engineers, I would give them a big hug. Because I think what we have in ultrasound has made it possible for us to diagnose vein disorders and treat them in a much more successful way, wouldn't you say?
I agree. The nicest thing about ultrasound is that it's painless. In case a patient comes in, a lot of times they're very frightened.
They are.
Most patients come in and they always worry that they have blood clots, even if there's really no indication of that. They become frightened, and so in my office, we have a very comfortable environment. It's not sterile. Actually, I have a couch in my waiting room. And so they come in and we really explain what we're going to be doing, and we're going to put some gel on their leg. We're going to have them be relaxed. It's in a dimly lit room because we're using a screen, like a television screen, and so we're putting some sound waves into their body, which is harmless and it's pain-free. So then the ultrasound, with all the digital sophistication, it actually images the blood vessels very nice. But that's not the only thing we see. We see muscle, we see arteries, we see bone, bursa. So all of the things from the skin line we're able to differentiate. So sometimes patients come in and they think they have a vein problem. Maybe they're having leg pain. But sometimes we can also, depending on what they present with, come away with more information than just the vein problem.